a dog's tail a bone? This is a question that I get from readers and viewers once in a while, and I thought I would address it in a video. The simple answer is yes. Your dog's tail it has bones in it. It's not all one piece of bone, but it does have bones in it. Because your dog's tail is more flexible and mobile than his arms and legs, it's easy to think that the tail is made of cartilage or muscle, but the canine tail is actually made up of a string of small bones. Similar to the vertebrae in your spinal column, each of the bones are enclosed in a muscle, which controls movements such as curling, turning, lifting, wagging, drooping. The tail is actually a very important part of your dog's anatomy and is an extension of the spine. The bones of the tail are also called vertebrae. They are bigger at the base and get smaller towards the tip, just like your dog's tail is shaped. Soft discs cushion the spaces between the vertebrae and allow for flexibility. The tail muscle and nerves facilitate the tail movement. It's a really complex tail structure of bones, muscles, nerves, and blood vessels, so it can easily be injured. Tail injuries are not something to take lightly. They can actually cause a lot of problems. So if your dog seems like he has a tail injury, you want to make sure that you seek care as soon as possible for that. Abrasions, simple scrapes or scratches can occur if your dog is near wire fencing or laying on concrete steps and wagging his tail, things like that. Abrasions are pretty common. If the fur has come off, if the skin is exposed, you can see the area is red, or you can see the abrasion. Make sure that you clean the area with mild soap and water. You can apply an antibiotic ointment and then wrap the tail lightly with a self-adhering bandage wrap. You don't want to restrict blood flow, so don't wrap it too tightly, and then just change the bandage and reapply, clean and reapply the ointment every day. You may need to use an e-collar or a cone to keep your dog from chewing on the bandage, but after a few days, it should be fine to take the bandage off and let the wound heal. If there is excessive bleeding or swelling, if the tissue changes color, you should take your dog to the veterinarian. If there's any excessive bleeding or swelling, you want to make sure you reach out to your veterinarian, take your dog in for a check, because it could lead to infection and damage to the muscles and the nerves in the tail. So you want to make sure that you get that checked out. Happy tail is another common tail injury. Despite the name, happy tail injuries are not happy at all. Certain breeds of dogs wag their tails constantly, which means that they hit them repeatedly against solid objects like furniture or trees, walls. This can cause injury to the tail, and happy tail often develops bleeding ulcers that won't heal because the source of the problem, which is the wagging, doesn't stop. So your dog's tail's hurt and he needs to rest it, but obviously if he is an incessant wagger, he's not going to stop. These injuries can expose the nerves and cause serious pain, so you really need to seek the advice of your veterinarian. Sometimes bandaging the injured area using antibiotics and medication to prevent infection, that will have the tail heal nicely. But other times, in chronic cases, happy tail doesn't go away. The dog won't stop wagging, the injury won't heal, and your veterinarian may need to discuss some other options with you. Surgical shortening of the tail is a possibility. So this is something to really take seriously, and definitely don't wait. Consult your vet as soon as possible. They're usually not emergencies if your dog has a happy tail injury, but they do require treatment to heal properly. Your dog can fracture their tail. Like any other bones, tail vertebrae can break. Very often, fractured tail occurs when a dog is hit by a car or has a serious accident like falling off of a porch or like a high bed, or the tail gets closed in a door. When that happens, that typically leads to a fractured tail. The location of the fracture has a lot to do with the treatment, so take your dog to the vet right away. If the fracture is located at the tip of the tail, it usually heals without any treatment, but the tail might have a little bump or a kink in it because it healed by itself. If the bones are crushed, part of the tail might have to be amputated. Injuries near the base of the tail often involve nerve damage and can be more serious. So it's really imperative that if you believe your pet's tail has been fractured, you seek veterinary treatment. Nerve damage can occur in your dog's tail. The nerves in the tail are protected by bony vertebrae, but they can still be injured. Typically, this happens when the dog's tail is pulled. It can cause stretching or tearing of the nerves. Breaks in the tail, as I mentioned, or fractures in the tail. They can also sever nerves. Typically, it's tail pull injuries that cause nerve damage. They can cause damage to the nerves higher up in the spinal cord even, which can affect the control of urination and defecation. Obviously, it goes without saying that you should never pull your dog's tail. You should also be careful when small children are around that they're not pulling the dog's tail. That can cause serious injuries that could result in long-term issues for your pet. There is also a condition called limber tail. Limber tail is a painful muscle condition that's thought to be caused by overexertion of the tail. It causes pain at the base of the tail that's usually sensitive to touch, and the remainder of the tail is often limp. So if you notice that your dog wags a lot normally and his tail has been pretty limp, try to just very gently give an exam of the base of his tail and see if it's very sensitive to touch. If that is the case, it is probably limber tail. Since a fractured or infected tail can look similar, it is important to consult with your veterinarian to enable the best treatment. Fractures might need to be treated in a different way. Limber tail, usually because the dog's tail is drooping and he's not wagging a lot of times that can be treated at home with some rest, and over time, it's caused by overexertion. So when your dog stops wagging, it can heal on its own.